Did you know that oftentimes patients with dementia aren't able to fully live out the last few years of their life? Medications are often given to treat dementia can actually worsen the side effects of dementia. And my question for you guys is, do you know anybody who has dementia? And if not, do you know anybody who's over the age of 60? Because if you do, then they're at a very high risk of having dementia. As a nursing assistant student, I get to care for many patients who have dementia on a daily basis, and I get to see how their cognitive behavior is affected by dementia, but I also get to see how music therapy can treat those cognitive behavior issues. And so I want to prove that Medicare and Medicaid should fund music therapy as an official treatment for dementia. And in order to prove this, I will be first explaining to you guys what dementia is, then I will explain what music therapy is, and my final point will be comparing traditional treatments for dementia to music therapy. The Alzheimer's Association defines dementia as an overall term for diseases and conditions characterized by a decline in memory, language, and problem solving. And so memory loss is a perfect example of dementia. Dementia side effects can start off with short-term memory loss, not being able to keep track of belongings, not being able to remember appointments and responsibilities, and even possibly wandering around a lot, just because patients with dementia kind of lose track of time. They aren't able to really understand where they're at or who they're around. And dementia is progressive, so these symptoms may start off as being mild at first, but they tend to become very severe as the person grows older and the dementia progresses. And dementia is caused by damage to the brain cells, and when there's damage to the brain cells, the cells aren't able to communicate properly how they should, which is why there are cognitive behavioral issues, because the brain isn't able to establish feelings and how it usually does, which is why the patient with dementia will oftentimes not know where they're at, or they might feel angry because they don't know where they're at or who they're around. And some common risk factors for dementia include age and genetics. I then now want to talk about how music therapy can be a great alternative to medications that are given to treat dementia. And if you do not know what music therapy is, according to the American Music Therapy Association, music therapy can be defined as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by credentialed professionals who have completed an approved music therapy program. This website also goes on to say that music can promote wellness, manage stress, alleviate pain, express feelings, enhance memory, improve communication, and promote physical rehabilitation. And so, like I just mentioned a few moments ago, dementia is caused by damage to the brain cells, which affects usually one area of the brain, if not a lot of areas of the brain. Just focus on one area. And with music can actually stimulate multiple parts of the brain, which is why music therapy can help somebody re-jog the memories that they have experienced in their past, and being able to experience those memories can bring back emotions and feelings and make that person feel alive again. And music therapy is actually can be proven as a treatment to stimulate more eye blinking, breathing, a better heart rate, and can improve mouth movement within patients who have dementia. And this idea was recorded in 1986 when there was an experiment where researchers observed how music actually affected the physical attributions of a person with dementia. And now I kind of want to get more into the medications that are given to patients with dementia. And according to the University of San Francisco, common medications given to dementia patients can cause tiredness, sleeping problems, vivid dreams, muscle cramps, headaches, constipation, confusion. And so these side effects are very unusual just because most of the side effects can also be side effects of dementia. And so for healthcare professionals, it's hard to tell whether a person is progressing more to their dementia or if the medications are just causing more side effects. Okay, and so now I want to compare the benefits of music therapy to traditional treatments for dementia, such as medications. And with music therapy being a safer alternative, Medicare, who funds medications for dementia patients, should also be willing to fund music therapy. And I'm going to talk about the cost of medications and compare those costs to the cost of what it would take to fund music therapy for patients. And according to our national website for Medicare and Medicaid, the U.S. spends around $4,056 to take care of just one patient per year. And there are about 3 million new cases of dementia in the U.S. every year. And so our country is just spending so much money funding these medications that seem very unsafe and unstable to be given to patients with dementia, because as we learned before, that these medications actually can worsen the side effects of dementia. And with music therapy, an iPod can be bought for around $100 with a set of headphones and some music downloaded. It'd just be around $100 or so, maybe even less, maybe a little more. But $100 is obviously a lot cheaper than the $4,000 it would take to give medications to just one patient for a year. And with music therapy, such as buying an iPod and a set of headphones for a resident, they're able to listen to music whenever they want to, and so it can be a part of their daily routine to just listen to music once a day for maybe 30 minutes. And being able to do that will stimulate parts of their brain and re-jog their memory. And so, in conclusion, music therapy is safer and more cost-efficient for patients with dementia. Now, during this presentation, we went over what dementia is and what causes dementia. Then we talked about music therapy and how music therapy can help. Then we were able to compare music therapy to traditional treatments for dementia. And I would just like to say again that Medicare should fund music therapy, because if Medicare and Medicaid are funding medications to treat dementia, then why shouldn't the safer and more effective alternative to medication also be funded by Medicare? And I just want to challenge you guys that if you know anybody who has dementia, just to try music therapy for once and see how it can just bring back their emotions and their feelings and make them feel alive again. Thank you so much for watching.